mode. Perfect. All right. So hello everyone. My name is Nishant Satpathy. I am a now fourth year medical student. I'll be presenting on dance therapy, looking at it through an allostatic lens and its effect on neurological care. So just to begin off with, I want to first define allostasis. So we actually began off the class looking at this paradigm shift from the usual term homeostasis. So in 1988, Sterling and Meyer defined allostasis as this idea of maintaining stability through change. And it was the ability they postulated the ability of the brain to anticipate changes in the environment and internally and initiate these physiological changes in order to adapt. So this was in contrast to the idea of homeostasis, that the body relies on these feedback loops to come back to a set point. And so this was actually very nicely illustrated in this figure that I have highlighted on the right of the slide, where we have the set point for homeostasis, whereas allostasis has these I guess, new horizons that have been established for each change in anticipation. However, this anticipation of what's coming next keeps us in this constant state of arousal. And ultimately, if we are exposed to these chronic stress, chronically repeated stress, the body endures these physiological changes that can ultimately result in this concept called allostatic load. So in 2007, McEwen postulated that the brain is this key organ of stress. And with aging, there is this change in synaptic connectivity, specifically in the hippocampus and hypothalamus, which are involved with the HPA axis. And although in the short term, the stress exposure is adaptive for like fight or flight situations or memory consolidations, for instance, like in the example of blood pressure returning back to a set point or examples like that. But chronic exposure to stress can lead to this increased wear and tear that they also define as allostatic load. And certain types of this acute stress, many chronic stressors, can actually ultimately suppress neurogenesis and cell survival in the hippocampus. And this chronic stress can also ultimately result in dendritic shortening in the prefrontal cortex. So all of these kind of maladaptive processes because of chronic stress can actually ultimately result in psychiatric and neurological manifestations such as depression, anxiety, Alzheimer's, FTD, and other disease processes. So taking allostatic and allostasis and allostatic load in the context of neurological disorders, wanted to take it a step further. So new papers have actually identified that this allostatic load can actually increase the sensitivity to future stressors and increase hypervigilance and cause this overall sympathetic overdrive. So it's been shown to increase in neuroinflammation, metabolic imbalances, neurotoxicity, and Alzheimer's disease, as I mentioned in the previous slide, is a great example. So there is been noticed a decreased connectivity in this default mode network and salience networks, and that's been in turn causing this decrease in memory and cognitive regulation, cognition, and social interaction processes. So this was a great figure that I found in the paper that I've been talking, that has been giving me the information from the previous slide, that was written in 2024 that shows this. So we have this anticipation of this potential stressful situation through interception challenges from allostasis. And in turn, in addition to activation the anterior cingulate cortex and the subgenual anterior cingulate cortex, prefrontal gyrus, all of that, in addition to increased inflammatory processes, gut activation, as well as metabolic and metabolites being increased, we see that there's a both in transdiagnostic impact in psychiatric disorders and neurological disorders, as we can see both here as well as in aging, and then leading to this manifestation in disease processes that ultimately have this overlapping similarity in where they're originating from. So, as I mentioned, anxiety, depression, Alzheimer's, and behavioral variant FTD. So now coming back to the original kind of conception of my talk. So dance. So before I even connect dance to allostasis, I first wanted to define what I'm talking about dance. So what is dance? So often used to tell a story or ritualistic practice. So dance has been considered as humanity's first language. So for our sake in this presentation, I'm defining dance as the use of a pre-choreographed rhythmic pattern of movement to accompany a musical arrangement. And dance therapy, which I'm actually going to be talking more about, according to the American Dance Therapy Association, is defined as a psychotherapeutic use of dance, movement, body awareness, and embodied communication to foster healing and wellness for individuals, families, and communities. So connecting dance therapy, dance movement therapy and neurology, we can dance therapy has been actually been increasingly been used as this form of rehabilitation, particularly in neurodegenerative disease and neurological injury. And I'm going to bring out two examples, for instance, with Parkinson's and stroke. So Parkinson's disease, as you guys know, is a neurodegenerative disease that has motor and cognitive manifestations. So, in a study examining this dance therapy as a therapeutic intervention, they used dance as a 1 hour a week for 8 week intervention versus just usual therapy, education, reading, maintaining of their usual activities, yoga, and they showed that this intervention just for 8 weeks, for 1 hour, showed improvements in mobility, balance, and motor disability for individuals with Parkinson's disease. More importantly, they also found that there was an increase in mental flexibility and motor programming for these individuals. Now, when talking about neurological injury, stroke is an example that I found in my literature review, which is known as an ischemic injury, that dance therapy has been examined in patients with chronic stroke, and improvements were shown in balance, postural control, and dynamic gait. So, this is a great figure to show the benefits of dance therapy just from a neurological context. And you can see here that just from neurological activation, because of dance therapy, we can see increase in brain volume, brain activity, cerebral brain flow, and just overall activation of the accumbens and just awakeness of the dopaminergic system. We can see increase in neuroplasticity, specifically in the prefrontal and temporal lobes, as well as hippocampal neurogenesis, which I had mentioned earlier on was actually decreasing because of increased allostatic load. And then an increase in nerve recovery because of dance movement therapy. We can see that there's a relief in inflammatory environment as well as reduction in the expression of aggregation of abnormally folded proteins, of which Alzheimer's disease is known to be a manifestation of that. So now connecting dance therapy to allostatic load. So I'm postulating and arguing that dance therapy actually reduces allostatic load. So first, dance therapy itself is a combination of motor, cognitive, and social intervention. And I'll talk more about that in the following slides. But first, dance therapy has been shown to cause a decrease in cortisol levels and cause an improvement in the overall stability of the HPA axis, the derailment of which has been in shown to be a result of increase in allostatic load. And in fact, the requirement of memorizing planned movements and executing them is actually a just a manifestation of the actual mechanism of what allostasis is. And so the practicing and training your brain to be doing that improves synaptic plasticity and prevents this rigid state that is actually feared in aging. And McEwen et al. In 2007 actually supported that social interactions and social support of which dance therapy has is significantly involved with, actually decreases allostatic load scores. And the physical exercise that dance therapy involves actually increases the neurogenesis in the dentate gyres of the hippocampus. So it was actually shown to increase both memory and participation in goal-dependent behaviors. So now I want to take a case study into Indian classical dance. So you guys are probably wondering, why is he going this way? So first, just as a background, I'm trained in this art form, and being and having trained for so many years, I've seen how regimented and involved neurologically this art form is, and I wanted to see, okay, how can we apply this into both neurologically and into this argument as well. So first, the art form that I'm talking about is called Bharatnatyam. So it's one of the eight formally classical dance forms of India, and it's attributed to a Sanskrit treatise on drama called the Natya Sastra. And it's a dance form that's composed of orchestrated body movements paired to Carnatic music. Interestingly enough, Indian classical dance is not just feet movement or just body movements. It's also a significant use of facial expressions and hand gestures that, when combined, actually communicate tales and stories. And from the Natya Sastra, we have this saying, Yato hasta tata drishti, which means wherever the hand goes, the eyes must follow. So it's a significant involvement of gaze, of emotion, of motor involvement. So you have a complete involvement of the brain. You have limbic system, basal ganglia, as well as cerebellum involvement, all of which, when combined, are used to create the art form. Practitioners of these classical art forms, such as Bharatanatyam, as I mentioned, focus on both the dance, of the facial expression, the hand gestures, and must also understand the music to actually create what the piece is. And it's been shown in a 2022 study that Bharatanatyam dancers, or dancers in art forms like this, are shown to have higher auditory working memory because of this neuroplasticity changes in motor planning that's extensively required in order to memorize all of these components in order to put on a performance like this. And interestingly enough, Bharatanatyam, the specific dance form, has been used to in treatment for individuals with Parkinson's disease to focus on balance, on stability, and um, and overall rhythmic and rhythm, specifically with the rhythmic dance sequences called jatis, which are just rhythmic dance sequences without any meaning, but that still require the focus of the feet work, the facial expression, and the hand gestures. And this actually work has been done by Dr. Shloka Iyengar at this organization called Dance for Parkinson's Disease in New York. And so actually this is a picture from one of her workshops in 2022. So now implications for neurological care. So my argument is that regimented styles such as Bharatanatyam or any of these styles that have these multiphasic components can actually be integrated into neuro rehabilitation efforts to improve clinical outcomes. And until now, there hasn't been any randomized trial to be done, but I feel that a randomized trial with at least like 8 months of group therapy targeted towards balance, hand gestures, facial expression can actually be done to understand the true implications of styles like this in rehabilitation. Initially, previous studies have done trials in tango and ballroom dance, which are partner dances, and they've shown to seen clinical improvement, specifically UPDRS scores in Parkinson's disease or the Berg balance scores for balance. And they've showed and they showed improvements. However, emerging evidence has been shown to support individual dance forms like the ones I've been mentioning, and they've been equally reliable in eliciting improvement in these cognitive and social outcomes. Now, tying it back to allostasis, in 2020, Gary Goldberg postulated that in individuals with brain injury and just neurological injury, instead of solely focusing on the lesion or the injury, we have to provide rehabilitation to decrease the overall allostatic load. So, closer to the time of injury, this allostatic load may be adaptive to prevent further injury. But after a certain time period, this process becomes maladaptive. Results in social isolation, depression, and actually just causes an overall just maladaptive process. So therapy such as dance movement therapy, as I've argued, actually decreases allostatic load, improves synaptic connectivity, social and cognitive skills. And that's my talk.
Fantastic, Nishant. Thank you so much. So, students, comments, questions for Nishant?
Yeah, no, I thought that was really cool. If you were to design sort of a dance program, what neurological condition would you pick and what dance would you pick?
Yeah, honestly, I would do it with so I know a lot of research has already been done with Parkinson's since that itself has a lot of um motor manifestations, but I would do it with Alzheimer's as well as Lewy body dementia. I think those two because um and I would do it with Bharatnatyam. Reason why is because this dance form has a lot of cognitive involvement with regards to being able to remember what is being said in the song, what is what you have to enact with the hand gestures. Um, and so with that, I think I would do a dance like a dance therapy session program using um, those two conditions.
Um, just a thought and a question that I had was, a lot of this population might have like limited mobility issues. So, and I'm going to butcher the pronunciation of the style
Yeah.
of dance, but like from a seated position, would it be pretty feasible to practice and get a lot of benefit out of this dance, do you think?
Yeah, actually, interesting enough, and I it would have prolonged the talk, so I didn't. So actually, what the practitioner has done in her work is she's modified the dance form to actually just include the hands. So instead of for individuals with very advanced Parkinson's who can't, you know, standing or move for prolonged periods of time. She's actually had them enact the feet movement with their hands, um, and still been able to show improvement in overall just cognitive um, decline as well.
Awesome. How about Kathleen or Sharon? Thanks for joining us. And Kathleen is a future neuro rehab specialist and also color guard expert. You must have all kinds of thoughts and questions for Nishant.
Yeah, I really appreciate the talk. I myself had given my own presentation on music therapy, and so, dance was one of the things I was thinking about talking about. There just not is not enough time to put it all
Mhm.
in one presentation. So I'm glad that you were able to dive into that and talk about the benefits of it. I'm just curious, what field are you applying into?
Neurology.
Neurology. Okay. I was like, is he going into PM&R? Because that sounds like very along the lines of what I'm going into. So, but neurology, that's great. Yeah, so did you come across at all like looking into music as well and its effects? I feel like they like individually have their own effects on the nervous system, and I'm just like wondering if you came across anything where combined people were looking at it, and if there's, any increased efficacy of the two.
I mean, 100%. In fact, actually, the paper that I was talking about with the increased auditory working memory, one of the components of that was because of having to a lot of these dancers actually have to learn the music style itself before um, in their training, like that are professional dancers have to learn the music style itself before they even begin dancing. So that was actually a factor in their analyses. So I actually found that very interesting.
That's such an interesting point. Like I'm now just wondering too, like in the rehab world, if introducing the music first before, prompting any sort of movement may help with just with the talks of like anticipatory
Hmm.
movement that our brains seem to like anticipating something. It may help generate, more motor control in that aspect. So really, really great. Thank you for your talk.
Thank you.
Terrific, terrific. Great questions, Kathleen. How about Sharon? Sharon is actually a first-year medical student from I'm sorry, Macon College. Sorry, you can introduce yourself, but she's been with us a couple times for these talks. Sharon, please.
I'm a first year medical student at Mercer University. It's actually located in Macon, so I think you confused there. But I only heard like the last part of the presentation, that it's about like dancing and allostasis. And I remember like Kathleen's presentation, I believe last time was about music, and you kind of incorporated movements there too. So it's interesting that you focus on dancing.
Yeah, thank you, Sharon, for introducing yourself and those thoughts. Yeah. So, Jess, any other thoughts or questions?
Right. You showed a slide when I was appreciating the cultural roots of this too, and how that may just be underneath all the movement and the learning and the hand-eye coordination and all of that, and appreciating that. And I might have read a little bit into this slide, but were you suggesting a control group that's doing more mechanical PT compared to the fluidity of dance and all that it takes in this kind of immersive experience?
Correct, exactly. So, this is actually similar to one of the papers I was citing where they had dance movement therapy compared to their just regular PT or usual yoga or regular just movement therapy that they usually do, and to compare whether just the fluidity and just I guess freeness of being able to practice an art form like this actually also contributes to improvement in cognition and balance and stability.
Wow, really incredible talk. And that the dose was 1 hour a week in the
Yeah.
first study that you showed. It's like, oh, this is minimal,
And
really, and what it would cost. Yeah. Thank you, Nishant.
Yeah,
And
no,
welcome, Sharon.
yeah, terrific. And to Jess's question, to that point, just that, we're actually comparing, very sophisticated methodologies here. I mean, physical therapy that's obviously a whole profession unto itself, and dance again, thousands of years of tradition, and I'm sure in all kinds of, mutually valuable ways, but there could be some some kinds of, motor repertoires or things that are kind of picked out more by one modality compared to another, right? And this just goes to show, I mean, it's amazing what we can really imagine in terms of interventional strategies when we just kind of depart this sort of just lumping into, oh, well, this is all placebo, right? Testing two placebos versus one another, right? So obviously, this is a level of sophistication, to be able to talk about dance through all these circuits, interoception, the limbic system, basal ganglia, cerebellum. I mean, it's just incredible. And just, two other little thoughts on this. Again, we could talk for hours on this, but one, I really like that slide you showed of that review paper. I hope people will go back to that one. I thought just based on the way you talked about in those like 3 or 4 figures those authors gave, I really liked how they kind of kind of boiled these things, these steps into these different processes of interoception and this pathway to transdiagnostic illnesses and so forth. And I thought it was actually hilarious that for interoceptive awareness and stress prediction, they showed a guy lying on the couch watching TV, right? It's this sort of very kind of underhanded reminder that in modern life this is how we're actually training our interoceptive senses, right? We're programming our bodies to get aroused in these different ways because of the media we consume, right? I mean, obviously they didn't get into that. That would be a whole topic unto itself, but they were cleverly putting that in there. I love that. And then the other thing I'll just kind of add is another point, just to further flesh out. I mean, it's kind of implicit in the things you said, and we also talked about it a little bit the other day when we were kind of previewing your topic. I think that dance is also, and this goes back again to this issue of just it being another form of sort of motor exercise, a very refined strategy for anticipatory training, right? Because I mean, think about it. When you're dancing, especially if you're dancing with another person, like you've got some partner dance, if you don't put your arm out at exactly the right moment, if you don't anticipate how they're gonna sort of put their back down, they're going to collapse and they're going to fall to the floor, right? And so there are very sort of fine tolerances that are being required of your motor system in the process of dance, right? If you miss a beat when you're dancing, then everybody will know you missed a beat, right? And so there's a really high level of coordination that's again being exercised. So you're really working that anticipatory motor mechanism of the brain when one dances. So I think that's another kind of way to think about the value here, or yet another way to sort of theorize about it. You are actually encouraging a narrowing of that prediction error, right? So the motor system needs to predict what it's going to do. You always have that little bit of an error, that calibration process. That prediction error is going to become much more narrow all the time in a sort of unforgiving, so to speak, practice such as dance, where you really have to coordinate. So thanks, Nishant. Terrific talk. Okay, so I'll stop there. Sorry.
Well, I appreciate that point, right,
Yeah.
about narrowing set points, because that's a really key part in understanding this paradigm shift. Yeah.
Thank you, Jess. Thanks. Yeah, no, awesome. You guys are just giving great talks here. So, okay. So how about let's move right along to James B.
So give me a moment. For some reason, I've lost the stop recording button. I'm not on my usual computer and there it is. Okay.